Good afternoon, everyone. Welcome to American University Washington College of Law. Thank you so much for joining us today. I'm Maya Manion. I am a professor of law and faculty director of the Health Law and Policy program here. On behalf of myself and our director, Asha Shelzo, it's truly a pleasure to welcome you to today's book talk. We are delighted to be discussing this terrific and very timely book, The Pregnancy Police, Conceiving Crime, Arresting Personhood. This important work sheds critical light on how legal frameworks have enabled the surveillance and prosecution of pregnant people and what that means for reproductive justice after Dobbs. We are especially thrilled to have the book's author, Professor Grace Howard, with us today. Professor Howard's scholarship has been at the forefront of examining how criminal law intersects with pregnancy. This book is both rigorous and deeply compelling. She will be joined in conversation with renowned reproductive justice advocate Renee Bracey Sherman, whose leadership has been transformative in reshaping public discourse around abortion and reproductive justice. Together, the discussion today will explore the legal and policy structures that have shaped pregnancy criminalization, and we will also be discussing the broader implications of this for reproductive justice, health equity, and the future of reproductive health policy. We are so pleased to partner with the American University Center on Health, Risk, and Society in presenting this event. And I also really want to thank Professor Tracy Weitz, who is faculty director of the center, for her collaboration and support. I'm also deeply grateful to our Health Law and Policy Program Coordinator, Tamina Asif, who I think is still outside, managing all the food for us, and whose tremendous work behind the scenes really made today's program possible. So thank you all for being here today, and we are honored to have such distinguished speakers with us. So it is my great pleasure to introduce Professor Howard and Ms. Bracey Sherman. Professor Howard is an associate professor of justice studies at San José State University. She earned her PhD in political science from Rutgers University. And this book that she's discussing today, The Pregnancy Police, is out now with University of California Press. Dr. Howard's body of work explores reproductive law and policy and the dimensions of legal personhood for people with the capacity for pregnancy. She has been broadly engaged in public scholarship on reproductive politics and law, with expertise that spans the criminalization of pregnancy, abortion, contraception, miscarriage, and eugenics. Her analysis and commentary have been featured in a wide array of national news outlets, including the Huffington Post and NPR. She is also a proud first-generation college student, a former birth and abortion doula, and, according to her, a world-class cat wrangler. Very versatile. She also has a forthcoming book that I would highly recommend as well. It is called, the title is What Do We Know and What Should We Do About Abortion? That is more for a general audience, and it is coming out this April. Renee Bracey Sherman is an award-winning reproductive justice activist, abortion storyteller. She's also co-author of the book Liberating Abortion, Claiming Our History, Sharing Our Stories, and Building the Reproductive Future We Deserve. For a decade, she led the organization We Testify, which she founded and which was dedicated and is dedicated to the leadership and representation of people who have abortions. Renee has been recognized as one of the most vital voices in changing the conversation about abortion experiences and using creative and innovative strategies to shift the conversation towards centering Black people, people of color, and other marginalized identities. In 2022, Renee made history by testifying before Congress and describing how someone can self-manage an abortion with pills in her congressional testimony. She also co-hosted a podcast called The A-Files, A Secret History of Abortion, and she was executive producer of an award-winning documentary, Ours to Tell, which elevated the voices of people who have had abortions. And fortunately for us, Renee is also a member of American University. She is currently a PhD student at AU School of Communications. So thank you both so much, and please join me in welcoming our speakers today.
Thank you so much. I'm so excited for this and feel really honored that you're taking the time and that, Renee, you've joined me for this. So the way this is going to work, I'm going to share a little bit of data and then we're going to open it up into more of a conversation. So this did grow out of my dissertation work at Rutgers University and unfortunately has only become more relevant in that time. So I want to start with Heather, and I opened my book with this case. This picture was in the New York Times. It's why I'm naming her. She was okay with being involved in having her face kind of be public. And her case is really exemplary, I would say. In 2011, a 25-year-old white woman named Heather Capps gave birth to a healthy baby boy via cesarean section. Her newborn baby tested positive for opioids. Heather had opioid use disorder, which developed after she'd been prescribed the drug to treat her chronic back pain. Heather lived in Alabama in a small town in the northeast part of the state. She'd heard about a local policy ordering the prosecution of women who use drugs during pregnancy on the basis that their drug use constituted a form of child abuse. She'd also heard that the withdrawal symptoms from quitting oxycodone could be dangerous for her and her pregnancy. She needed help. Heather was unemployed and relied on Medicaid and $200 a month in food stamps to support her family. She was referred to an inpatient drug treatment facility in Birmingham, nearly an hour-and-a-half drive away from her home. As a single mom with 2 young children, inpatient treatment was not an option. Who would look after her little boys? Heather felt trapped, and seeing no other solutions, she decided to gradually taper down her use of oxycodone to take the lowest possible dose in an effort to protect her pregnancy. 2 days after Heather gave birth, and still recovering from her C-section, she was arrested at the hospital. She spent the next 3 months in jail, separated from her newborn, that like fat, gorgeous little baby, and her 2 other children, unable to post the $500,000 bail. Over a year after her arrest, Heather pled guilty to a charge of chemical endangerment of a minor, a Class C felony. In Alabama, crimes designated as Class C felonies are punishable by 1 to 10 years in prison. And she was given a 3-year suspended sentence, meaning if she completed rehab, she wouldn't have to serve 3 years in prison. She was ordered to stay in a halfway house while she was in that court-ordered rehab. During that time, she was permitted to see her children once a week. So for Heather to finally access the drug treatment she wanted and sought out, she was forced to self-manage her substance use disorder through a pregnancy, was forcibly separated from her newborn and 2 other young children, was arrested and forced to spend her first 3 months postpartum in jail. She pled guilty to a charge of felony child abuse and then assigned to that halfway house, with the stress of a possible 3-year prison sentence weighing over her. And something like that has happened to over 1,000 people in my case studies alone. I looked at South Carolina, Alabama, and Tennessee. I found 1,116 confirmed arrest cases in those 3 states alone. I know that is an undercount, and that's from 73 through 2020. 267 were from South Carolina, 747 were from Alabama, and 102 came from Tennessee. And interestingly, the states adopting these formal criminalization policies aligned with 3 racialized drug panics. So South Carolina, this is happening primarily in the 90s when they started going really hard on this. They were predominantly worried about Black women who used crack cocaine. Among the initial arrests, there was only 1 white person, and it was noted on her medical record that the father of that baby was Black. Alabama was really focused on meth. This was happening in the mid-2000s. It's understood in that context to be like a white trash drug. Was never really widespread use. We don't really even count meth as its own category when we're measuring drug use most of the time. It's lumped in with other synthetic drugs. But in this case, like nobody could stop talking about meth. And then in Tennessee, it was opioids, right? Which is a little bit different. I think because we conceive of the population of folks who are primarily using opioids as white working class people, I think that we have been willing to adopt a more kind of less punitive, more public health approach, unless they're pregnant, in which case it seems like we're more than willing to go back to the old punitive kind of war on drugs style stuff, even though we've, maybe we're learning that that's not effective. People always want to know what can you get in trouble for? So most of these cases did involve drug use, like Heather, but all kinds of things. Self-managed abortion, not taking good enough care of yourself during a pregnancy. I don't even know what that means. I think about the amount of pizza I've eaten in the last week, and I'm like, have I taken good enough care? I don't know. How they handled the products of conception after losing a pregnancy, people who survive suicide but miscarry, people who reject medical advice, which is supposed to be a constitutionally protected right, people who are in car accidents and lose their pregnancies. In one case, someone was arrested after she failed to protect her fetus from third-party harm. She was shot in the abdomen. She was arrested because they said she instigated the fight. And in another case, someone was running from the police. I think she had an outstanding warrant for something. So she's fleeing, and you're going to get in trouble if you're fleeing from the police. But they tagged on a reckless endangerment charge because she was pregnant while she was doing that. And then the charges, all kinds of charges, really wide range of penalties as well. But inflicting great bodily injury to a child, unlawful performance of an abortion, homicide or homicide by child abuse, distribution of drugs to a minor. There are two ways we can charge this. The first is if you are worried about Roe v. Wade, which we're not anymore. If you're worried about Roe v. Wade, we can say in the moments after you gave birth, where we now have a born child, but the umbilical cord has not yet been severed, you were pumping tainted blood to that baby. That is delivery of drugs. If we're like the other way, right, is if we're not so much worried about Roe v. Wade and about whether or not a fetus is a person, and you can just say during the duration of the pregnancy, right, your blood is getting into this child. Involuntary manslaughter, when we have pregnancy loss. Reckless endangerment was a pretty common one. But the three most common charges in South Carolina, it was unlawful neglect of a minor. In Alabama, it was chemical endangerment of a minor. And in Tennessee, it was fetal assault. Sources of information. I know a lot of us are worried about our period tracker apps. There have been like an endless number of news stories. I know that kind of digital forensics is very sophisticated, what we can do, how we can track movement and thought and action. But it's a lot more simple than that. And so far, at least in these pregnancy cases, 77% of cases resulted after a healthcare provider made a report. If you're going to be locked up for a crime against your own pregnancy, chances are it's because a healthcare provider reported you. Social workers also made reports. We use medical records as evidence in these cases. In some cases, it is your neighbor, it is your boyfriend, it is your roommate, it is your friend, it is your mom's friend. In one case, they used a Facebook post. It was a pregnancy announcement. So someone had been caught. She'd been drug tested while giving birth. And then they went and looked for kind of supporting evidence for a prosecution. And they found she made a pregnancy announcement. And they said, and yet, even though she knew she was pregnant, she continued to use drugs, saying that she had intended to harm her child. In another case, a crisis pregnancy center shared the information. You'll know what CPCs are. I'm seeing some nods. These are not healthcare facilities. These are anti-abortion centers that are often religiously affiliated, but many of them receive state funds. The people in there most of the time have no kind of medical training or license to practice, but they cosplay as doctors and nurses, literally wearing scrubs. And like, I have a stethoscope around my neck, so that means I'm a doctor. They are not governed by any kind of medical privacy laws because they are not practicing medicine. And so they're really like collecting a lot of information about people and what are they doing with that information? They're sharing it. So in this case, I've redacted some of the identifying information. It was the, is this a laser? Yes, the Save a Life Center. Nice. It's a chain of CPCs in Alabama, gave information about the regularity of her period, about her contraceptive practices, and about the date of her last menstrual period. And they used this to support an argument that she knew she was pregnant, but continued to use drugs. People are also very often interested in the outcomes. I know there's a lot of misinformation about especially illicit drug use during pregnancy. There are way worse things you can do during a pregnancy than like take meth. And I'm not telling you you should get pregnant and start taking meth, but that's not really what's happening here either. In most of the cases, we have a healthy baby at the end, right? Most of the folks in these cases did desire to give birth to their children. They were seeking support in doing that. In 89 cases were designated as complicated births. These were usually premature or low birth weight. Sometimes they cited withdrawals. Maybe we can talk about it in the Q&A. Diagnosing withdrawals from a drug is not an objective practice. It is highly racialized and classed. Even though we've created assessment tools that are supposed to eliminate biases, they don't. So I'm raising an eyebrow at some of these withdrawal cases is what I'm saying. In some cases, it was self-managed abortion. Some cases we had miscarriages or stillbirths. Those were 77 cases total. And notably, 7% of the births happened outside of the hospital, which is way over the 2% US average of births that occur outside of medical settings, indicating that people are avoiding care for one reason or they're not able to access care. 11 cases involved multiples, which can just be like roll of the dice, let's double your charges, twins or triplets. You can be serving those sentences concurrently or consecutively. 7% of births, I said that. 208 cases involved people who were still pregnant when they were arrested, which means you're spending some or all of your pregnancy in a jail, which is probably the worst place where a person can be when they're pregnant. These are not safe, clean, drug-free places. The earliest arrest happened at 6 weeks LMP, about as early as a lot of us realize we're pregnant, and there were 17 arrests made in the first trimester. So you're potentially spending many months in jail. So that's some of that data I have, and now can open it up a little bit.
Awesome. Thank you. Let me give Grace, Dr. Howard a round of applause. This is really incredible research, and I think for most of my career, this is the thing that I think with the pro-choice advocacy, with the movements, everyone's like, freedoms, let's make sure that people have access to abortion care, contraception, right? But they leave out how criminalization functions, and that this has been ongoing while Roe was the law of the land, that this is actually something that has existed so long as we've had laws and pregnancy. And they're quite surprised with this intersection. But let's take a quick step back, just like overall about the book. This, you said, came out of your dissertation. And this is like a culmination over a decade of work, which is absolutely incredible.
My youth.
Yes. What drew you to this topic initially?
So, I have tenure. I'll disclose things. I did a self-managed abortion when I was a senior in undergrad. I had no money. My parents couldn't help me. I used plants. It worked, and I didn't have to go to the hospital. And it was one of the most empowering, dare I say, sacred experiences I've ever had. And I had a vague awareness at the time that what I was doing could hurt me, and that I could get in legal trouble for it. I had a very frank conversation with my housemates in a feminist housing collective called the Womansion. I know.
I love it.
Yeah, that okay, if the bleeding's too much, if I get a fever, what you're not going to tell them is that I did something to make this happen, right? That we're going to be really vague about this. I'd heard a couple of stories, but I didn't really understand how pervasive a practice this was until I was getting my PhD. Cindy Daniels' gender and public policy class, I learned all about this. I think Shatima Threadcraft was co-teaching that semester. That this is something that's been happening for a long time. It's been happening in a lot of different conditions. And I thought I knew stuff. I was a pretty active and engaged and critical person in undergrad. And I was offended that I had not really learned about this until I was getting a PhD, especially considering my first generation status. Just who gets to get a PhD? I very easily could have never learned about this ever. Why aren't people talking about this? It seems so central to all of the arguments that we're trying to make about liberation, but we're not talking about that. And so then I just followed that rage through like the rest of my 20s and wrote a book.
I love it. I love it. I mean, I want to talk about why we don't talk about this, right? Because some of the cases that you profile are over 20 years old.
Yeah.
And I think when I've been out on book tour and conversations, people are like, well, they're going to start arresting people for what happens to their pregnancies now that, you know, Roe is gone, post-Dobbs. But like, they've been doing that.
Are they going to start that?
I know. Yeah. I'm like, that it has been happening the whole time. One, can you talk about why people assumed that was not happening? And also, what has shifted, if anything, post-Dobbs?
So I think a lot of us are really uncomfortable with drugs and pregnancy. Well, drugs, period, and pregnancy, period, and both of things together, like even more so. I know that talking about folks who use drugs, a lot of the mainstream repro rights organizations don't want to talk about it because it feels even more taboo than abortion somehow. Like, is there anything more taboo than abortion? Yeah, using drugs during pregnancy and then not having an abortion is maybe more taboo.
I would say, you know, talking about capitalism and poverty.
Yeah.
All the things that go with that.
We're already on the margins, and this will just marginalize us even more. I know a lot of those groups would say this is a race issue, not a abortion issue, not a reproductive issue, which is pretty laughable and offensive, frankly. Yes, initially, most of the people who are being arrested are people of color. That's true nationwide. Alabama is sort of, at least during that bracket, the only exception. It's because they were really focused on white trash, which is its own weird thing. So I think the stigma of that kept a lot of folks away from it. And it wasn't primarily happening to people who had abortions. It was happening to drug users. And we don't care about them. We put them in cages. Unfortunately, like maybe we should have been paying attention to that because the frameworks that they built to move people along through that pipeline are being used for abortion criminalization, can very easily be reproduced and used in the context of abortion criminalization. So even if you don't care about pregnant drug users, like it's your turn now, right? Like these systems never stop where they are. They need to continue to expand. And without the protection of Roe v. Wade, which some prosecutors did seem nervous about Roe v. Wade, that like, I think I can legally get away with what I'm doing, but like, maybe we need to wait until after the birth has occurred, right? Or maybe we need to wait until after viability to do anything. And without that, one of the changes, I think we are seeing still primarily focused on pregnant drug users. We do see miscarriage cases popping up. We do see self-managed abortion cases popping up. I know the arrests about drug use are occurring earlier in the pregnancy now. And that's because Roe's gone. So like seeing more of those first trimester arrests, I think is a logical outcome here. That prosecutors felt a little bit nervous about it before, and now they're like, it's game on, you know. I get hot. Sorry, I'm fanning myself.
So actually, let's stick on that self-managed abortion point for a minute, because one of the things that I find that people are quite surprised about is that there are no laws that actually criminalize self-managing an abortion in the entire country, with the exception of Nevada, and it's in the second trimester only. Here in Washington, D.C., it is decriminalized to both self-manage an abortion and help someone self-managing an abortion. It wasn't that hard to do. All I had to do was DM City Council member Christina Henderson. So if you see her, shout out to her for making that happen. And yet, people are being arrested and prosecuted for allegedly self-managing their abortions. And what you talk about in the book is that some of these arrests happen with no legal basis.
Yeah. Or even they happen under conditions where the law says you cannot arrest someone in this context. Like Texas had, at the time anyway, explicitly said, yes, we recognize the fetus as a potential crime victim. No, you cannot prosecute the pregnant person for a crime against their own fetus, period. But Texas was doing this all the time. I've been calling it something really stupid because it's amusing to me. And I don't know if any of you remember the show Reno 911, but it's a parody cop show. It's so stupid. I've been calling it new boot goofing with the law.
New boot.
There's this like sheriff guy. He's the one with the really short shorts, and he gets his white ostrich boots that he's very proud of on layaway after 7 payments, and he's in the parking lot and he's put them on and he's like, ha, ha, jumping around with his boots and just like showing off and feeling really proud and like goofing around in this parking lot. Interviewing these prosecutors, they essentially told me, are we law students primarily in here? Yeah, they told me that the law is whatever they can get away with. Mm-hmm. I know you're like, we're learning all these technical things, but it's just like whatever random prosecutor Joe can get away with, and that they think the fetus is a person, and that they think the fetus is being abused, and that they know that these are the people who get arrested in these cases are like throwaway people, and that they're poor, and that they're not going to be able to have a great defense, and that they're strongly encouraging plea bargains to even more so avoid any kind of potential legal challenge, that they just know they can get away with it. So there's a case, I wrote an op-ed a few months ago out of South Carolina, while the South Carolina Senate was debating, adopting essentially an abortion criminalization law. Like, it is a current event that they do not have that law yet, right? And they killed that attempt that time, right? That we're not going to criminalize abortion. During that time, a woman is arrested there for allegedly self-managing an abortion. And I don't believe that that's actually what happened. It's what the cops are saying, but we know that they lie a lot. They're saying that she took something to cause an abortion. I don't think that that's true, right? But they're getting away with it, even though it's like, yeah, it's on the news every day. It's on the national news every day that South Carolina hasn't criminalized abortion yet, and we're trying to. They're confident enough in themselves.
So, I mean, let's talk about why they can get away with it. I think poverty is such a big factor that it's how we see the people who are criminalized. What do you think? Like, what is the role that poverty and like racism and classism overall just plays?
I know a big role, and I'm doing some new research on this now, looking at which hospitals we're seeing people come out of. Right, these cases are mostly coming out of hospitals. I know for South Carolina that there was a case that ultimately went to the Supreme Court, Ferguson versus City of Charleston, right, where MUSC, the university hospital, it's like the hospital in the area that takes Medicaid patients. And like, oh, coincidentally, they're all poor and Black, right? So I'm curious to see the role that, like, how much hospitals that take Medicaid are these primarily. I think, the respectability politics of it all, like, a lot of people don't think that poor folks should be allowed to reproduce, period.
Which is eugenics.
And
that's actually just straight up eugenics.
Yeah. I have a chapter about kind of early eugenics in the U.S.
So let's talk about it. How are you want to talk more about how those are connected?
Yeah. So, the Buck v. Bell case. Some of you nodding.
What is that for in case? Because I know we have some one of my classmates is here, so we have some non-law school folks.
Okay, it's short and very readable, so highly recommended. I teach with it a lot, and my students don't like to read. So it's 1927. There's a girl named Carrie Buck. She is poor and white and would be considered white trash, and this is near Charlottesville, Virginia. And her mom's name is Emma, and she's had multiple children by multiple men. Records are kind of, oldie time records are tricky, right? It's not clear if these men abandoned her or died or whatever, but she's got 3 children. And she's institutionalized because she is a woman who is not married, who is having children. They're desperately poor. She's engaged in survival sex work. And eugenic thought was very popular at this time. And the idea that we have these social inadequates running around rampant on the street, doing whatever they want, that like this is going to bring down America. And there's especially an argument about whiteness here because Carrie and her family are white. And eugenics did target non-white people. In this period, in this context, white people are freaking out. And we're doing it again right now. We're freaking out about the white birth rate, which is going down. We're freaking out about immigration. We're freaking out about race mixing. And so we're passing all kinds of laws trying to target that. And here comes eugenic thought, the idea that, social conditions are heritable. So if you're poor, it's because you're genetically predisposed to be poor. And if we can eliminate the poors from reproducing, we eliminate poverty. is the thought process. So, and the same with sexual lasciviousness, right? That like Emma had multiple children with multiple men and she was not married. That's wrong for any woman to do, right? So she's institutionalized. Carrie is put in foster care, ironically with a family named the Dobbs family. She is raped while she is in that family's care by one of the family members. She becomes pregnant. And when her pregnancy starts to show, she is institutionalized because the Dobbs family couldn't, how embarrassing. Their ward is visibly pregnant and unmarried. And so she's actually put in the same institution as her mom. She gives birth to that baby, Vivian, there. They take the baby away. She never sees Vivian again. And it's at this time that Virginia has passed its eugenic law. It has a brand new eugenics law saying that the government can sterilize people under XYZ conditions against their will. The guy who ran that institution, his last name is Pretty, and he's been sued a few times for sterilizing people against their will. And he's afraid of getting in trouble. He's like desperate for a law. He's finally got his law. And now he wants to test it. And so they choose Carrie to be their test case. She does not appeal. She's not like, don't sterilize. I mean, I don't think she wanted to be sterilized, but she has no part in this. This is like external parties arranging all of this. The attorney that they give to Carrie is also a eugenicist who is like friends and comrades with the people trying to sterilize her. They put forward like no real argument for her. And there's this interesting idea. They're sort of obsessed with the idea of 3 generations of reproducers. That after 3 generations, you can know for sure. And this is some of this, like, I don't know if you remember the little, from high school, the pea pod charts with the white flowers, pink flowers, right? This is how they're looking at human reproduction too. That like, if you're abnormal, you could be recessively abnormal. And after 2 generations, we'll see the recessives come out so you can know for sure. A social worker met with baby Vivian and said, yeah, I know the family's history and that could be biasing me, but I think that there's something wrong with this baby. And that means we've got 3 generations of imbeciles is the word that they used, which is a euphemism. In the court case, yeah, which is a euphemism. In that case, like sexual impropriety and poverty seem to be the thing. So on that basis, yeah, they moved to sterilize Carrie. The sterilizers win. The Supreme Court said that 3 generations of imbeciles are enough. They said basically these people aren't smart enough to even know what they're missing and they won't care if we do it. And if we can draft soldiers who are the best people, then why shouldn't we be able to end the reproduction of society's worst people? Real short case, not a lot of deliberating happening here, right? It's pretty disturbing. So I definitely see that at work.
It's still in the books.
Oh, yeah. So if you heard of, it's never been overturned. It was cited in Roe v. Wade. Mm-hmm. If you've heard of, great replacement theory, that's like Elon Musk's like lower back tattoo. Says great, right? That like certain kinds of people should be reproducing and they should be rich, white, like, I don't know, they think that they're really genius-y, but they're not. Men, right? That he wants to have legions of children that are like him. You can see Jeffrey Epstein wanted to like have a bajillion little Epsteins because he thinks his genes are so great. Right? And because like immigrants and people of color are so scary. That if they take over, they're going to subjugate us the way that we subjugated them. And so we better be reproducing. Yeah.
And I think there is this in society, we have this like, with this, along this eugenic logic, we have this idea of who is a fit parent and who is not.
Yes.
We see this in actually adoption policy in which people are coerced into relinquishing their children simply because they do not have the money at the time of giving birth to raise their children.
And then we'll pay another family.
They will get the tax break and pay money to raise that child instead of just allowing them to be raised by their parents. There's an incredible book by Dr. Gretchen Sisson called Relinquished, which you should all read.
Yeah. And Dorothy Roberts' Torn Apart.
Oh, yes, Torn Apart is incredible, and about the family policing system. And that through line is this criminalization, this policing, particularly at a moment in which legally your body is it's your own, but it's not your own. Yeah. And using the things that you do to your body against you, whether they are things that generally people might say are fine because you're just refusing a medical treatment, or things that we are stigmatized, like taking drugs, using substances, right? And you talk a bit about how respectability and like anti-Blackness and particularly like whiteness factors into that. And I also want to bring in this central theme of the policies around protecting women and their babies.
Yes.
This protectionism, we have to like make sure they're safe. We have to make sure the babies are safe. It's extremely paternalistic at best, but it's obviously like not real. You talk about this velvet hammer approach. So do you want to like bring all that in for us?
Yeah.
Like, what does this all mean? How does this show up, particularly in criminalization of pregnancy?
So before I forget, I'll say what a velvet hammer is. Every prosecutor I talk to used the phrase velvet hammer. That like they are the wielders of the hammer of justice, right? But like we care. We're doing this to protect them. They don't know any better, with the exception of one prosecutor. All of them had this very benevolent, paternalistic, like, we don't want to punish them. We want to help them make the right choices. And so instead of like, I don't know, like an iron hammer of justice, it's just like a velvet hammer. We're like still hitting someone with a hammer, but like it's softer, I guess, is the idea. So 38 states have laws that define the fetus as a crime victim in certain situations, and those laws are almost always adopted, or at least framed by the idea of pregnant people being violently attacked, which, you know, the time in your life, if you're a woman, that you're most likely to be murdered is when you're pregnant, and pregnancy, homicide is the leading cause of death of pregnant people in the US right now. So like, not unfounded, right? This is a problem. We murder pregnant people a lot. And I get wanting to do something about that. And it's really interesting that the choice we've made isn't like, let's address intimate partner violence. The choice we've made is after they get murdered, they should be punished for killing the pregnancy too. So Laci Peterson's case, right? This inspired a federal law that's nicknamed Laci and Connor's law. Connor being, you know, what she was going to name her baby. She was like the most pregnant, you know, when she was murdered. The Connor's body was found in the bay, and then her body was found, and we think that her husband did it, but there's no forensic evidence, and he's appealing, and it's all pretty horrible. But yeah, we take these awful cases and we really blow them up, and I would say exploit them. You don't care. You don't want to protect a pregnant woman. You don't want to protect a baby, right? It's like so disingenuous. And using the tragedies that these families have experienced to then inspire laws that could be used to punish a pregnant woman just like the person who was murdered. But then again, maybe not just like, because so states that adopt these, it often is in direct response to an actual case, like an actual homicide case. And they'll name the law after the victims. They'll put the families, you know, the families demanding justice, the families' grief, and then use it to adopt these so-called protective laws. But these protective laws get cited when we are building the case law for criminalization. If the fetus is a crime victim in that situation, why isn't the fetus a crime victim in every situation? And moreover, why isn't the fetus a person everywhere else in law? It does kind of, I mean, you know, when Roe was good law, it does create a legal conundrum, right? In Alabama, for example, that you could legally, intentionally end a pregnancy, and that is a constitutionally protected right at that time, but that you could not unintentionally, potentially harm a fetus without it being a felony, right? And so in resolving that, what have we done? We've taken more rights away from the pregnant person. I would argue making the pregnant person even more vulnerable to harm, right? We know that reproductive coercion and abuse is up. We know that keeping someone pregnant is one of the ways that you can prevent them from leaving. And if they give birth to children, very difficult to sever legal tie, sharing custody of those children. So I think it's only exacerbated this problem. But yeah, we, instead of like getting to the root of the problem, social conditions, just slapping a punishment Band-Aid on after the fact is the way we do it. And it doesn't stop pregnant people from being murdered. Yeah.
I want to open it up and give you all a chance to ask a question. Does anyone have a question? Friend. Hey. Go for it.
So I have a question, and I'm wondering maybe how you are thinking about this. I teach health law here. My name is Thomas Williams. I see some of my students here, but also lots of familiar faces. So I let my students know last week that a new head of CEDAR was actually going through the Senate confirmation hearing. CEDAR is the Center for Drug Evaluation and Research at the FDA. And one of the things that came up in her testimony was about a focus on evaluation of the safety of use of like SSRIs and drugs around mental health during pregnancy, which initially I said, this is great. Lots of women want more guidance on what makes sense and how to make choices around that, right?
Yeah.
Like evidence-based stuff.
Yeah.
But then she goes on to say that a fetus is essentially like a pre-child.
Yeah.
And then I was like, oh.
They love that preborn language.
Yeah. And so I guess I'm wondering, like, you're talking about illicit drugs. But like there's all kinds of social stigma around drinking coffee, eating brie, having a deli sandwich when you're pregnant.
Yeah.
And I wonder if you have concerns about what it might mean for us to have validated research that indicates fetal risk, and what it might mean around criminalization of like well-known used drugs that treat specific right concerns and that present real risks. But I guess I wonder, like, can we broaden your theory out to think about drugs that are FDA approved and what kinds of things we might see coming down that chute?
Yeah, so I primarily was talking about illicit drugs because those are the ones that hold so much like stigma. But people in my cases, there were people who were locked up for drugs they had been legally prescribed. And there's a whole battle over, call my doctor. Like, I swear I have a prescription for this. The Marshall Project just released a big study. They found like thousands and thousands and thousands of cases where people were reported because they tested positive for drugs that in some cases they were given in the hospital. It's like, yeah, we gave you fentanyl and then you tested positive for fentanyl. Call the cops, when I was talking to the prosecutors and I told them like what the state Supreme Court in Alabama had done with their work, they were like, they broadened it from an illegal drug to any substance. And one of them like yelled like, that could be coffee. And I was like, yeah, dude, it could have been coffee. And like, you did this, right? I think, some people really want to focus on this drug doesn't do harm. We don't have data. It does harm. And also I don't care so much about that from a legal perspective because you're still a person or not. Like, are you a person or not when you're pregnant? Right? It's a legal substance. You need to take substances. You need, let's make a choice. You're either going to keep taking your SSRI and maybe hurt your baby, or you're going to stop taking your SSRI and maybe become suicidal and maybe hurt your baby. Pick one, right? Like, impossible choices. So a harm reduction approach is definitely my preference. But in terms of the law, I sort of don't care about potential of harm. I care about the humanity of the pregnant person first.
How do you feel about the research, though? Because they're going to lean on science as the basis.
Oh, yeah. I mean, we should have more research, right? People should be able to be more informed about, right? I know a lot of people that want to know more about what marijuana does because they're using it for morning sickness and they want to make sure they're not going to hurt their baby, right? But I don't think that learning more about the science of what can happen during your pregnancy should mean that the pregnant person gets fewer rights, period. And unfortunately, I think that is how they're going to use it, right? I don't know, they're talking about Tylenol causes autism. Okay. What if it did? Are autistic children really that much of a horror? right? Like I'm getting diagnosed, y'all. 37. Right? Like you can see, I think, the eugenics at work there too. Like the way that they talked about crack babies, and we know like that's not a thing. Mm-hmm. But the way that they talked about crack babies, that like these moms are evil, they're damaging their babies on purpose, they are unleashing like zombie hordes who are going to cost a lot of money and not be able to hold down a job and be inherently violent. And like, yeah, none of that's true. And if it were, is the answer to start locking those moms up, or is the answer something different? And for me, the answer has to be something different. I don't think that your rights should go away when you become pregnant.
Thank you. Another question. Go here.
As a kind of a follow-up on that, were you seeing at all a disproportionate number of moms who had had C-sections getting arrested? Because I assume that they're more likely to test positive for something like fentanyl. In fact, I'm pretty sure I got some while I was,
Yeah, you probably did.
And if you were seeing that, do you have any stats or information about the kind of really, I'm guessing, mediocre healthcare they got postpartum while they were incarcerated with a French 6-inch incision?
Yeah, so I don't know how many of them involved C-sections. I noted the cases that said in the records that were on the public record that mentioned C-section, but that's an interesting question. I think it is probably likely that, right, if you're being given more drugs, you're... in terms of the aftercare, it's a nightmare. So like Heather had a C-section and she was arrested at the hospital and she had a suicide attempt on her medical record. And I don't know if y'all know this, but if you have a suicide attempt, she had an overdose on her record, a prior overdose. We treat a prior drug overdose like a suicide attempt, whether or not it was. And that meant at the jail, she went into suicide watch. Suicide watch in a jail, it's like solitary, but you're naked.
Yeah,
okay. So she's just been cut open and had a baby taken out of her, and her milk comes in and it's leaking down onto her belly, onto her surgical site. And she doesn't even have a pad for the vaginal bleeding. She has nothing to clean herself up with. It's just like, we don't treat animals like that. And remember, we're doing it to protect her and to help her make the right choices. We know that trauma is a reason why people use drugs. I don't see how treating someone like that is going to make them less if I were treated like that, I would want to take all the drugs. Get me out of this reality, because that's what just happened to me, right? Pretty hideous stuff.
Go here.
How do you think we go forward from here? I know I've talked with specifically Professor Abrams about what the next steps are because abortion is illegal in so many places fully, what the next step is to kind of try to grapple with that and bring some of it back so that we have any reproductive rights at all. I know that we've spoken about IVF and how that could possibly lead to that. Do you have any other insight into where we go?
I'm just always reminded of how Roe was never enough, right? Every single arrest in my study happened when Roe was still good law, right? And so even if we still had Roe, this shit would still be happening, but I think fewer of us would be talking about it. So as dark as it is, and as shit, y'all. It's not a good time right now. But this gives us opportunities to make something better. I'm very interested in the kind of underground extra legal efforts that people are taking right now to try to protect one another. I'm very interested in mutual aid. I'm not a lawyer. From a bigger legal perspective, though, we do need a affirmative, your humanity doesn't go away when you become pregnant thing on the books, right? And Roe did not give us that, right? You start to be less of a person at viability, and then we can do stuff to you, right? And that we kept this reverence for the fetus even under Roe. I don't know what your idea, you're right, in terms of what legal strategies should be, but yeah, I think talking about the difficult cases stop ignoring the stigmatizing stuff. Like, these are our realities too. And if we keep excluding them from the conference, right? Okay, here's the bee in my bonnet. Okay, do you remember, a couple years ago, Alabama Supreme Court said that frozen embryos are extrauterine children? Fascinating. And everyone was mad about that. And there were tons of op-eds, and we should have been mad about that because that's outrageous. And Alabama had already said that fetuses are people. They said it in 2013 in the context of a drugs during pregnancy case, right? And they cited that case 7 times in their frozen embryos are people case. But people weren't pissed about it back then. We saw it as just. And so what might be, right, if we stop only looking at the respectable stuff, that I think that opens a lot of doors for us too. Some like liberatory shit.
Yeah. Awesome. Okay. Go ahead.
Really quick, I'm curious about CPCs. Mindful that they receive state funds and are clearly presenting as medical providers. Have there been any attempts to hit them with medical malpractice lawsuits that have been successful at all, or failing that fraud?
Like, yeah, there's actually, there's a case about funding at CPCs at the Supreme Court right now. They should not be allowed, right? I mean, like, like any means necessary, like, yes, cut fund. It is astonishing to me that these are federally funded. And it's because, they say they provide services, but those services are what? Like a free non-diagnostic ultrasound that's been conducted by someone who is not licensed to perform ultrasounds, just like some random goober in scrubs. Free pregnancy tests, you could get those at the dollar store and they won't give your information to the cops. Maybe a pack of diapers, that's going to get you through a couple of hours, right? Like, yeah, it's astonishing they're allowed to exist. And they do receive like gargantuan amounts of state funding, but I think it's seen as, yeah, they're providing services. That's how they get you in the door. Right.
Even the provision of client information, I mean, these people clearly have a pretty reasonable belief, I would say, that they are in a setting where that information will be protected.
You would think that. Yeah, I think that, yeah, there's some weird, I mean, maybe it's this like religious consciousness clause type.
They're not actually practicing medicine, therefore
Yeah,
they're not
just
bound by HIPAA or anything else.
But you would think like you're wearing scrubs and you have a stethoscope and you have an ultrasound
But you wear that
machine.
on Halloween.
Yeah,
What's the difference?
It's more new boot goofing.
Yeah, it's imagine if it's Halloween and everyone, you go in there and everyone's just dressed like a doctor. You should not assume they're doctors, even though clearly you would.
I think the Women's Law Project is doing, I mean, they've done a lot of incredible work on CPCs and some great reports, and also, oh God, what's Liz Winstead's?
Abortion
access. Yeah, I have a literal sticker for their organization on my laptop. That they're doing also like to look up and see what the fake clinics are in your area, because they often will give themselves names that sound very abortion clinic-y, and sometimes they even locate themselves like next door to confuse you. So there is a lot of incredible work being done on these, but yeah, like legally speaking, victories have not been many yet.
If I can add, one other thing is their role, I think, is to just spread the anti-abortion ideology in our communities. And they start out as like these wacky, weird places. Like I went and investigated one in Maryland early in my career over a decade ago. And so as we're waiting for the 2-minute pregnancy test to turn positive, which it had like 10 minutes before, but they were talking to me until I was no longer abortion minded. Yeah. So I could literally see the test that it's positive, like by their arm. Yeah. So I knew it was done, but they're still like, we're just waiting a few more minutes.
Yeah.
And one of the things that they started talking to me about was, how abortion pills are very, very dangerous, and the remnants of abortion pills and of pregnancies from when people have abortion pills, it's actually in our drinking water.
And that's why we need a strong EPA
to
only regulate birth control in the water.
And I looked at them and I was like, there was a water bottle sitting there and I was like in here? And I'm trying not to like laugh. And they're like, yeah, no. And that might have sounded like wild. And for a long time I told that story and it was very, very wild. And yet We have 25 House members, House Republicans, who sent a letter to the EPA asking them, could you check to see? And the New York Times reported they interviewed some former EPA members that, or EPA staff, that they actually do have the technology to be able to locate if there are remnants.
Yeah.
To the house, to the block.
Yeah, which they've just found one in South Carolina.
Yeah. And I think it's one of those things that, again, they're not necessarily, there's this guise that like, well, abortion medication is dangerous, which we know it's not. It's one of the most studied medications that we have, right? But what they're looking for is more ways to criminalize. Yeah. And I think that is something that, when people are like, how did we get here? That's something that the FDA is talking about. And I think CPCs are one of those ways where they just say these things over and over and over again until it becomes
like, even if you are only there to pick up a packet of diapers, right? Or like the case that ended up being referring to the cop. She went there for a free pregnancy test and ultrasound. She did not want to have an abortion.
Yeah.
She couldn't get a free ultrasound anywhere.
Yeah.
You know, and then they got her.
I think we can have one more question and then I'll answer a closing question before we finish. Go for it. Yeah, you.
Well, thank you so much. My question relates sort of like criminalizing not only, I guess in my vocabulary, also patients and like medical providers. I'm thinking a lot of like the EMTALA case that came out of Idaho and like how, you know, they want to criminalize medical providers if they even suggest or use certain words, or, you know, they lifeline people outside of the state to get emergency care. I guess, like, maybe, I don't even know how to frame the question, but, like, how, in states like that where they're criminalizing not only you for wanting to have an abortion, but criminalizing medical providers for even suggesting it, like, how would that be navigated? Like, what efforts should be done in places like that?
I've been thinking about the tension there between the healthcare provider role in criminalizing and the healthcare provider as a target for criminalization for a long time, right? We know that physicians were very involved in the criminalization of abortion the last time around. And so, like, yikes, history. You know, the way that they're doing it now is lengthy consults with hospital lawyers who will not talk to me. I've been trying to talk to these hospital lawyers. They do not want to talk to me to see what is your actual policy, or do you even have one, or is this a case by case thing? What is the decision making here? But yeah, right now it means you might be, becoming septic, but we need to figure out what we can get away with legally, or how dead you almost have to be before we can intervene. And that's a pretty hideous problem. We can blame the law for that. We can blame the hospital lawyers for that. I mean, I'm not someone who's a physician who could get arrested for doing that, but I would hope that more physicians would intervene before their patients die. And then to hope that the kind of, I don't know, if you have a shield as a healthcare provider, because these are some of the most powerful people in our society in terms of respect and resources also, that you would just do the right thing and we'll see what happens legally, right? I don't know. If anybody has a pot of grant money for me, I have been trying to talk to nurses because they are the ones that are doing the bulk of this. They're the kind of the criminalization gatekeepers in a lot of ways, especially with the drug stuff, and to talk about what their decision-making process is like. When do you call the cops and when do you not? We know they're not reporting every positive drug case. They're not, right? The numbers would look way different if they were. So when are you deciding to test? When are you deciding to report? And under what conditions are major questions that I have. I want healthcare providers to just be brave and do the damn thing, but I know that's a risk that a lot of people aren't willing to take. I would say all my heroes have been incarcerated. I don't know.
Awesome. So you talked a little bit sort of about with folks about what you hope would happen. And I think in closing, I have a bit of a two-parter question. One is that you cite some absolutely incredible scholars in this book who I think people should read. Dorothy Roberts, who was just here last week with her book, The Mixed Marriage Project. But she has so many incredible books, Killing the Black Body, Torn Apart, Shattered
Fatal
Bonds,
Invention.
Fatal Invention, yes. Kira Bridges is just like such a brilliant human. Michelle Goodwin, who's over at Georgetown. Write all those names down because they're great.
Read everything.
Read everything that they've written. Like those books I think are great. And like, what else would you also have people read or building on those, I guess?
I love Wendy Bach's book, which is about Tennessee specifically. Criminalizing Care, I think is the name of this one. It's really, really good. I love your book. Seriously, I think there's a lot of writing about Jane. People are very interested in, the abortion collective that was doing illegal abortions in Chicago. It's like, a lot of us are thinking about this kind of underground work right now. The stuff that you have in your book is like new and very compelling.
I did not tell you to say this.
I know, but I'm saying it, right? Like the idea of having your patient information written down on cards and consuming that paper because the cops might be coming is like, okay.
I literally ate it.
You're eating paper, right? It's maybe writing things on paper now is probably safer than the internet, right? Magazines. There's so much good. Yeah, everything Dorothy Roberts has written, I think is a really good place to start. Like Killing the Black Body changed my life.
Yeah, same.
That book totally shifted my perspective, and I would highly recommend that. And I think like read people's abortion stories and read people's stories of criminalization. And if you really want to get into something, write letters to people who are locked up and read the letters that they write back. If you have a Books Through Bars program, that was also like a very revolutionary experience for me. Seeing people's handwriting, requesting books, and, I want cookbooks so that when I get out, I can cook for my kids. Or I want to read about the Black Panthers. What do you got? It's like a wonderful experience and very eye-opening for me.
Yeah. Okay, and then the second part is abolition activists have always said, like, abolish the cop in your head and your heart. And I think, for us, our work is very much trying to get people to abolish the pregnancy cop in our head and our heart. How would everyone go about doing that?
I said that a bunch of times at the last NAF meeting. You've got a pregnancy cop in your head. We all do. Even if you don't act on it, like if you see someone who has a baby bump and they're sipping a glass of wine and you're having judgy feelings about it, like, okay, maybe think about what that is. If you see someone who's thinking about someone we went to PhD program with who's like very pregnant and like doing CrossFit and just like killing it and everyone's so worried, just like, well, let her worry about her pregnancy, right? That don't get rid of the judgment and offer support when needed and asked for. Making support available is so much better than judging people. It makes them want to hide, right? And isolation isn't good for anybody. Stop reporting people for things, right?
Stop snitching.
Stop snitching
Bring
on
back
people.
the stop snitching movement.
That like helping people find resources is better than reporting them to the police, because the police are not going to help that pregnancy. They're just not.
Yeah.
And social workers maybe will and maybe won't, right? Like these systems are all imbued with carcerality. So just try to remember that these are humans and that they deserve to be treated with respect, period, regardless of anything else. And they're humans who are pregnant too. You can be both.
Well, let's all give Dr. Howard a hand. You're welcome. And folks can purchase your book.
Yeah, I have a few copies if you would like a copy. I'm also happy to email PDF proofs if you don't want to buy something.
Yeah.
Hi everyone, I'm the program coordinator to Minasi for the Health Law and Policy Program. I just wanted to thank you guys so much for joining us for this amazing book talk. I want to thank you all for coming in and joining us as well. I want to thank Professor Maya Mannion for facilitating this introduction to our program. And I wanted to thank you to Director Tracy Weeds, the director of the AU Center on Health, Risk, and Society for partnering with us on this event. There's also a bunch of people at WCL, our support staff, who have worked behind the scenes to ensure everything runs smoothly. Our catering department, our facilities department, our AV team, including Ryan Say, our special events team, including Courtney Watson, and our marketing team, including Keith Pierce and Liz Newton. And then we would like you guys to join us this Wednesday, March 4th. We're partnering with our student-led health law and policy brief to present a half-day symposium on revolutionizing drug development and regulation and the impact on AI in pharmaceuticals. This will explore how artificial intelligence is transforming drug development and the legal frameworks guiding it. Our expert panelists will explore the legal, ethical, and policy challenges shaping this rapidly evolving field. This is going to be a hybrid event, and it's going to be in person down in the ceremonial classroom. But thank you guys so much for joining us.
Thank you so much.